Hello everyone, my name is Robert Johnson, student of Nightingale College. Today I will be performing a video skill for a subcutaneous injection. Before I begin, I'm just going to go ahead and go over the fact that I have my uniform on. I am wearing my school ID, and as well as the scrub pants and shoes. Right, first things first is I need to, of course, clean my hands because I just got to the facility. I normally will wash my hands or clean my hands. I do have hand sanitizer. That's what I'm using here in this blue bottle. So first things first is I want to always make sure that I compare the doctor's orders with the electronic health records. What I'm doing is I'm comparing the 6 rights. I'm going to be checking the 6 rights or doing this verification 3 times. So what I'm doing is I'm comparing the electronic health records to the doctor's to the doctor's orders, and what I'm checking for is the right patient, right medication, the right dose, the right route, the right time, and the right documentation. So that is the 6 rights. After comparing the doctor's orders, everything looks good with the electronic health records. From there, I will check the electronic health records against the MAR, the medication sheet. And what I'm doing there is also checking the 6 rights, making sure all of that matches up. It does. As I mentioned earlier, that this video is for a subcutaneous injection. The order says I'll be administering 1,000 units of heparin. And what I have on hand, it is coming out of a medication bottle, a heparin medication bottle, and it is what I have on hand. It is a coming from a 10,000 units per 10 ml units bottle. That's what it's coming out of. So because of that, I will have to do dimensional analysis, right? And I went ahead and calculated this on the whiteboard. So what it is what I have on hand is 10 mLs per 10,000 units, and the order says 1,000 units. So what I did was I canceled out the units, multiplied across, and then divide, leaving me with 1 milliliter of heparin to give. That's what I will be administering, 1 milliliter of heparin to give. So let me put this over here on the side. The syringe I have on hand, it will be coming out of the 10 ml 25 gauge 5/8 syringe. This is the one I have on hand for the heparin, right? This is a 1 ml syringe, right? And first things first, so I went ahead and verified all the 6 rights. These are my supplies. I'm going to be taking with me to the patient's room. I have gloves. I also have the medication, the heparin medication. I have 2 alcohol wipes, and I have a gauze, and I have the syringe. So from here, I'm just going to go and introduce myself to the patient. So let's go knock on his door. Hello, Mr. Jones. My name is Robert. I am a student from Nightingale College. And the reason why I'm here is because I have medication for you. It's actually a subcutaneous injection. It's going to be for the medication heparin. And your doctor wants you to have this the purpose of this medication is to reduce blood clots. But before we go any further, let me go ahead and wash my hands and provide you some privacy. Okay? So I'm going to pull the privacy curtain. Curtain is pulled. I'm going to go ahead and wash my hands, right? Wash my hands. Even though I just came from the sink, I'm still going to use that hand sanitizer and wash my hands here. Now that my hands are clean, I do have, now I can go ahead and do a double check on the patient's ID. What I'm going to do is I'm just going to ask Mr. Jones, can I please see your ID band, please? Okay, from here, I am going to verify Mr. Jones's his name. I'm going to have him verbalize his full name and his birthday. Mr. Jones, can you tell me your full name and your birthday? Okay. Ronald Jones, birthday March 5th, 1965. Okay, thank you, Mr. Jones. That looks good there. And because now I just received Mr. Jones' name, I'm going to go ahead and do my second check and compare that name that I just received up against the MAR, making sure that it's the right patient. It's going to be the right medication that he's going to receive, the right dose, the right route, the right time, and the right documentation, right? So that's what I'm checking for, and everything looks good there. Mr. Jones, before we begin, do you have any allergies at all? you have any seasonal allergies? Do you have any any allergies to drugs or medication? No? Okay, Mr. Jones confirmed that he has no allergies. Let's see here now. At this point, I will explain to Mr. Jones the use of this medication and how the use of this medication is an anticoagulant. And the purpose of this is to reduce blood clots, right? So your doctor said something about the blood clots in your legs. He wants to reduce that. So that's why Mr. Jones is getting it. I will also inform Mr. Jones of the side effects that this medication has, and which can cause easy bleeding or bruising. So for that reason, I want to also alert Mr. Jones to any precautions, such as I want to remind him not to use any razor if he's shaving, right? He can easily cut himself, and it'd be hard to stop the bleeding. I would inform Mr. Jones of those precautions. Also, adverse reactions include, I would let Mr. Jones know that he could witness or even see bloody stool or blood in his urine, or even that sometimes maybe cough up blood. So I would like to inform Mr. Jones to also let us know if he sees any of these type of adverse reactions. And then I would also ask Mr. Jones, do you have any questions about this medication? No? Okay, no questions about the medication. So from there, I'm going to confirm with Mr. Jones where would he like his injection. There are usually 3 places you can give it. It can be the upper arm, the abdomen, or on the leg. And Mr. Jones confirmed that he wants it on the abdomen. Now, the site that we're going to actually give this injection is going to be to the right of the umbilicus. So it's going to be right here on the belly, right about this area. And from there, I'm going to go ahead and do hand hygiene again. Can never be too much. And I'm going to go ahead and prep the medication. So let me go ahead and put gloves on. Okay. And gloves are on. Okay. So first things first, I am going to clean off the top of the bottle, medication bottle, right? Clean off the top with the alcohol swab or alcohol wipe. I'm going to get rid of this. I'm going to let that air dry. With the syringe, right? I am going to draw up exactly 1 ml of air, just air, right? So there is 1 ml of air. Go ahead and take a look at that. That's 1 ml of air. I'm going to remove the cap, and I'm going to inject the air into the bottle. There. And put the air into the bottle. Now I will invert the bottle. Now from there, I'm going to take out or draw up 1 ml of heparin per doctor order. 1 ml of heparin. Right? And I want to tap on the syringe if there's any air bubbles leaving the syringe inside the bottle. Make sure our syringe is in the bottle. There's no air bubbles, so it's good that way. I'm going to remove this. Now, because I still need to do a little bit more prepping for the patient, I'm going to put the cap back on, but it's going to be a one-hand scoop technique. So what I'm doing is I'm just going to scoop the cap. One-hand scoop. Got that back on. It's just for safety reasons. Don't want to try to recap. That's back on, right? So, as I said, I'm going to be prepping the patient. So, since the medication is pulled up and because I had to use dimensional analysis, what I'm also going to be doing is having another nurse there to verify my calculations are right, making sure that what I calculated is going to be the right amount compared to the doctor's orders. So my coworker, fellow nurse is here. They're going to go ahead and verify this. They're going to verify this against the orders. They're checking the MAR. Making sure the orders are right, the calculations are right. They may even do calculations themselves. Everything looks good. We both compared and checked the MAR again, right? So that looks good. So that's actually our 3rd time of checking the MAR, right? Just throwing it out there. That's the 3rd time. As I said, there's going to be 3 checks. So, also, what I'm going to do is I am going to wipe down the area, the chosen site on the abdomen to the right of the umbilicus, I do believe I said. So we're just going to wipe and going to go circular motions about 2 centimeters outwards, 2 to 5 centimeters outward. And I'm going to let that air dry, right? And I am going to hold the syringe like this, just like I'm holding a pencil. I'm going to take the top off, right? And what I'm going to do is I'm just going to pinch the skin. Let me see if I can do it this way so you guys can see. I'm going to pinch the skin, and I want to make sure that I kind of size it up to make sure the amount I pinch is going to be about the size of the needle, right? And I'm going to be coming in at a 45 to 90 degree angle, right? So I'm going to come down kind of hard, like not hard, but kind of fast like a dart. Make sure that I get it in. As the medication is in there, I'm going to release the skin, bring my hands up to support the syringe. And just a side note, I would have had also told Mr. Jones before the injection, I would have told Mr. Jones, this medication or this injection is going to feel like a little bite or a little poke there in your abdomen, right? So just FYI, I would have had make sure I told him that information beforehand, right? Before I just stuck him. So I just wanted to throw that out there. So yeah, this injection would have felt like a little bite, right? So then we're going to go ahead and move forward. Since I got the syringe in, and we're going to slowly inject the medication into the stomach, into the abdomen, very slow. There. Okay, now the medication is in, slowly. I'm going to get my my swab ready, and I'm going to remove the syringe and place the swab right over the spot. I'm not going to massage it. This syringe goes into a sharps container right away because we don't want any accidents. I'm just going to check it for any bleeding. No bleeding, so that part looks good. And then from there, Mr. Jones, how you feeling? Okay. Mr. Jones stated he's fine. I'm going to give him the call light, and I want to clean up my area. Clean up the area. And Mr. Jones, please let us know if you have any questions or any concerns. Right? And from there, I will take off my gloves and do hand hygiene, and then I will go and document this procedure. Thank you very much for watching.